Why do you want hair?
I think I'll feel better about myself.
There are certain advantages to being bald, Richard.
Well, that may be so, Doctor, but I want hair. I want lots of hair.
I have Dr.Mani Mittal of London, UK. Thank you, Dr.Mani, for joining the podcast. I'm really excited to have you on.
Well, first of all, thanks, Melvin, for introducing me, and thank you for having me on.
I get a question often, and it's usually from guys on the forum that are really light-haired guys with fine hair. A lot of the doctors in Europe, especially the doctors in Spain and Portugal, they have patients with darker hair, but also thicker, coarser hair. And so it leaves them thinking, well, where are the results of guys like me? And I think this patient that you're going to present here is a perfect example of a guy who's got, strawberry blonde hair, really fine hair. He's about a Norwood 3, right? Bordering Norwood 4, I would say. What were the challenges with this patient? How do you approach a case like this?
Well, so firstly, I really enjoy working with fine hair. Personally, I think you can actually create even more natural outcomes using the finer hair. When you're looking at darker haired patients, you're trying to kind of go into certain areas, maybe just above the ears and sort of more into the nape of the neck to try and extract those finer hair follicles to place at the very front. Obviously, singles being the most important. With blondes or strawberry blondes, gingers, you will often find that they naturally, even in the prime sweet donor zones, they tend to have finer hair follicles anyway. Of course, if you're a complete Norwood 7, the density is not going to be as good as that of somebody who maybe has got darker, more coarse hair. Someone like you, for example, Melvin, you've got, beautiful, thick black hair. So you're going to get a better outcome with far fewer grafts. But if you strategically take out the right grafts, and I'm talking about specifically aiming for your high multi hair follicles and placing them properly, then you can get a great outcome with fine blonde hair, subject to setting your expectations out realistically. So I think, look, from my point of view, I really enjoy working with fine hair. But the challenges with working with fine hair and fine skin, light skin, is the contrast. It's a lot more challenging to see the direction of the hair follicles, especially once the hair is all shaven down, because there's a bit of a mismatch in terms of contrast. I extract all of my grafts myself, so I make all of the holes, all of the scores around it, and we'll use different varying sizes of punches. My practice primarily stems around FUE now, and we'll go from 0.7 up to 0.85 millimeter punch if we need to. And the depth control is another thing that a lot of people or a lot of surgeons don't talk about. The deeper you go with your punch, yes, it's going to be far quicker and easier to remove those grafts, but the risk of transection is a lot higher. The scarring left behind is going to probably be higher. So I tend to go in no more than about 2 millimeters max. So my punches are no longer than about 3 mils. The longest punch I've actually got in my toolbox is a 3.5 millimeter length punch. I tend to go in very, very superficially. And yes, it does often take 2 forceps and a bit of time to remove those grafts from the holes that you've made, but it leaves a smaller footprint behind, even with bigger punches. Even if I got up to a 0.85 millimeter punch, a lot of the time patients are going to struggle to see exactly where I've taken the grafts from. So when patients come into me saying, "Hey, Manny, look, I want to leave as little a footprint or little scarring as possible around the back of the head," number one, you have to advise them and tell them that it's not a scar-free procedure, but you will do your best to try and limit the amount of scarring left behind so you can sport shorter haircuts on the back and the side. And I think, why was FUE created in the first place? Number one, to be able to cherry pick the hair follicles that you specifically want. But number two, it's because, people who wanted to sport a shorter haircut, like, grade 1, grade 0.5, back and side short, they didn't want to have that long linear scar that was visible. With a FUE, you can disguise it a lot better with the hairs that you leave behind. So as long as you leave enough hair behind, then you will leave a smaller visible footprint.
That's an interesting thing. I've never heard a surgeon tell me that the depth can affect things. I know that certain shallow cuts, obviously, the more shallow you go, the higher chance that you're going to transect the follicle. I wasn't aware that, the deeper you go, the smaller the footprint of the actual extraction. One big pro that light-haired guys have over, dark-haired guys, like I have lighter skin and dark hair.
Yeah.
Kind of the worst, actually the
Yeah.
worst, because
Yeah.
the contrast is awful. And
Yeah.
also you see the scarring a lot easier because it's like you see a black hair and then a visible circle void of hair. And
Yeah.
so it kind of just draws your eyes, where like if you're someone who's blonde with really light skin, really light hair, it's really hard to see those little holes, those and even the hypopigmentation. If you're really fair skin, it just kind of blends in. So I'm always jealous when I see these guys on the forum. I'm like, man, you can shave your hair, you can't even see anything. It's amazing. And another big pro is, and I think you'll probably show here, is the hairline always looks so soft and natural. It may take more grafts, which I think is a bit of a con, but that's a big pro, is having that really soft natural hairline. Wow. That's amazing. So that's how many grafts was this?
I believe 2,100 grafts.
So 2,100 grafts.
Let me just check that to confirm.
Yeah, and you could see it looks really, really, really natural, really soft. And I'm a bit shocked that you were able to get that kind of density with 2,200 grafts with a guy with hair so fine.
Yeah, I think, look, like I said, it boils down to, number one, setting out your expectations realistically with patients as well. I think I'm not saying that every patient is going to get the exact same result, but I think if you focus on quality extraction, like I said to you, why was FUE, in my opinion, why was FUE created in the first place? It was to be able to cherry pick those hair follicles that you really and truly want. And that's what I do. I'm sat there, and yes, I punch at a reasonable speed, but I am there physically scanning the back of a head for every hair follicle that I can take that is going to be a multi hair follicle. And the more you have, the better the density is going to be with fewer grafts. I very rarely transect, very rarely, and that comes with taking your time. If you focus on your one patient a day, and you put all your effort into trying to get that patient the best possible outcome, so much can be created with very few grafts. And my whole mantra is less is more.
A lot of people will say, and of course there's a lot of younger guys, and I think we'll segue a little bit later, but a lot of guys will say, well, why didn't you go lower, right?
Yeah.
Why wasn't the hairline lower? I would want mine, to be a little bit lower.
I think that's a very, very interesting point there, Melvin. I think, and it boils back to the first thing that we talked about, and it boils down to the consultative process. The consultation in itself is so important. Getting those expectations drawn out right off the bat, because, there are certain things that I'll be willing to do. And yes, in certain patients, I may decide to go a little bit more aggressively. Let's say you're 26, 27-year-old who's not a particularly advanced Norwood 2. Or a very, very minimally advanced Norwood 3, then yeah, maybe I will look at going a little bit more aggressive, provided that you don't have a significant family history of hair loss, provided that you haven't gone on to lose any hair in the last 5 to 8 years or whatever. There's a bunch of things, and that's what it boils down to. It boils down to, setting the expectation right off the bat, making sure patients understand that, as you get older, you will mature. And as a result, you should mature into your hairline, not out of it. If the goal is just to get more hair on your head, then I'm probably not the right surgeon for you in the first place. If you want finesse, if you want a little bit of artistry, then come and speak to me. But if the goal is primarily to get more hair on your head, I'm sure that you'll find that patients will find other clinics out there that will be able to achieve that at a far cheaper cost than me.
Yeah, and there's always the telltale signs of these clinics where it's like, it looks like they literally just drew the line with the hairline with the ruler. It's so straight and there's no artistry. It doesn't look natural. This hairline honestly looks about as natural as it can get. It looks like the guy, just he has this natural hairline. And it looks like it looks amazing. But you have some examples of guys with more aggressive hairlines. And obviously this guy's 41. Your goals from being 26 will be vastly different to when you're 41, right? What looks acceptable on a 20-something-year-old is going to be different than what looks acceptable on a 50-year-old. But like you said, you should be growing into your results.
I feel like I'm one of those records on repeat right now. But truly, and I can't emphasize this point enough, it is probably one of the most important conversations that any doctor is going to have with any patient. Is number one, setting out the expectations and setting out a clear long-term plan so that patients understand what they're getting themselves into. Truly, that is, and I see so many heartbreaking cases. There's a surge in young patients. I'm talking 28, 29-year-olds. I said this earlier, who are coming in, who have had, 2 procedures already. Their donors are completely battered, completely destroyed. And there's very little that I can do. I know other doctors now are starting to do punch-out sessions, small punch-out sessions, maybe taking 200 from one side, relocating them into other places. I just and body hair transplants and whatnot. I'm not a big fan of that. I think you can remove those hair follicles and reduce the scarring risk by other methods, like for example electrolysis, or potentially even using laser. Laser is probably a little bit more widespread, so you might lose a few more hairs in other locations. But I understand the want to reuse some of those bulkier hair follicles because the donors are completely destroyed. And again, if that's the case, I will politely decline to take those patients on. It's not worth the risk for them nor the risk for me.
Absolutely. And I think you could avoid all of that by doing your research the first time around and not getting in that position, right? Because once you're in a position of needing a repair, like you said, there's all these options like, removing the grafts, punching them out, electrolysis, but all of them have big, huge drawbacks. Punching out grafts from your frontal zone could leave some scarring. You mentioned electrolysis, which could kill some of your other hair. I mean, it's not a good situation to be in, and you're going to be paying way more money than what you probably paid the first time around. So do it right the first time. And if you meet with a surgeon and they're telling you, look, your expectations it's not possible, then maybe you should reconsider even getting surgery. You had another case up that was a little bit of more of a aggressive hairline, you could say. This was another fine-haired gentleman.
Blonde. This is blonde.
Blonde guy. Yeah, hit the thing, Jerry. There we go.
Okay, so this guy, as I was mentioning, really nice guy, been a great advocate for our clinic. Changed his life dramatically, gave him so much more confidence, and he's been kind enough to do videos, talk to other patients. He's talked to probably at least a good 100 patients since he's had his procedure, and such a great outcome. But yes, he had fine hair, very blonde hair, very fine hair. Excellent to work with because, like I said earlier, it helps to just create absolutely beautiful natural outcomes. And what I was alluding to before is if you have an older guy, so this guy's sort of early 30s, but if you have an older guy that has very stable hair loss, from 28 to 31, ideally in this age group, and they want a slightly more aggressive hairline, then you can look at creating that. The most important thing, so if this guy had his chin down, what you would notice, although it looks almost like a straight line here, it's not quite. The apex of a hairline should always be lower than the point it meets the temple. So if he had his chin down, which if anyone watching is interested in seeing, it's all on my website. But if he has his chin down, you'll notice that the apex of a hairline is lower than the point it meets the temple points here. So although it looks relatively flat, it's all about the illusion, right? It's the perceptibility of what a hairline looks like. So then creating the temple peaks on the side and restoring this recession here, but also bulking out where he was thinning in this frontal forelock. This is where the illusion needs to really be recreated, because the most important point, in my opinion, of a hairline is this egg-shaped area, this frontal, sort of 2 to 3 inches in length and 2 to 3 inches in width. Very important. If you create a good amount of density in that area, you can get away with slightly lighter density in the sides because the eyes are naturally drawn to the midpoint of the face.
Absolutely. That's such an astute point, and I think that I've always talked about this, that you don't have to go super aggressive on the sides. If the middle part, if the front part is low, that's what your eyes are going to be drawn at. And as the hair grows outwards, depending on how you style it, it's going to give you the appearance of a really low aggressive hairline without really being that aggressive.
So this is him immediately post-transplant.
You can see that it's not completely straight, but it is a more aggressive hairline.
Correct. And if you look at the density, again, when people talk about high density, this is probably hovering at around about, in the midsection, maximum 30. On the sides here, probably at around about 35 grafts per square centimeter. Nothing more than that. I genuinely didn't feel that he needed anything more than that. And the kind of proof is in the pudding. When you look at the results in themselves, the naturalness of the hairline is what the most important thing is, in my opinion. How soft the hairline actually looks. With blonde hair, it's phenomenal.
This was at how many months?
This is when I took these pictures. This was about 10 and a half months. So this is about a year ago, these images. So about 10 and a half months post procedure.
10 and a half months. So he still had a little bit of growth. I mean, not a huge amount, but he still had a little bit more maturing to go.
This is, you got to remember, when I took these pictures as well, this is when we was doing a video session. So a lot of recorded stuff with this gentleman on that day. So there's a lot of light. I mean, you can see it on his forehead here. There's a lot of light hitting his head. Okay, a lot of light. And even then, in my opinion, it looks very, very natural.
No, yeah, absolutely. He's got a thread up on the forum where he had he posted his hair like after the shower, like it was kind of damp, and he kind of has it sort of like a messy kind of hairstyle, and it looks really, really, really good. Doesn't even look like an illusion of density. But you'd have to figure this guy. You mentioned the 50%, the 50% rule, which I think is crucial, right? People always assume that 50% of your natural density is something like 100 grafts per square centimeter. That's not, no, that's way off.
I just wanted to bring up, for example, a darker head patient, okay? So this guy, he's nice guy, Italian chap, but with Italian people, they've got darker hair. And again, there's only so much density you can give somebody who's got greater density further behind, okay? So with this guy, again, I've done 2 sessions. So the first session was around about 2,000 or so grafts to try and give him a decent amount of density in the frontal forelock. We did a second pass, and this is sort of, so first surgery and then second surgery. So I think the best thing to do is to kind of show it in terms of a video. So you've still got a bit of maturation to happen in terms of hairline. But we also bulked out the crown as well. So with thicker hair follicles, it's always, you're going to get more improved density as a rule of thumb, but you need more grafts per square centimeter to be able to create that, i.e., how I was talking about fair skin, fair hair has less transparency, exactly what you alluded to before. Dark hair and dark skin go really well, but dark hair with fairer skin is a lot more.
I feel the pain. I mean, it's not ideal. But I mean, there's obviously, this guy has hair like mine, like really, you could tell it's pretty thick. The problem with hair like that is, like, if there's a thin spot, the light will shine through it, and the contrast between the light skin and the dark hair will draw your eye so quickly. Compared to someone like the other gentleman that has blonde hair and light skin. But this is an amazing result. I have to say, it looks really good. The density looks excellent. And you really can appreciate it in photos like you can in the video. The video, you can appreciate it so much because, like, just look at that right there. That's incredible.
But that's why we came back and we did a second pass on this chap at the front, because, he was happy with that density. In fact, it was beyond his expectations. I just can't help but be a little bit, my technicians tell me this all the time. They're like, sometimes you can be a little bit too anal. And I am very, very, very pedantic with my patients, because I wouldn't settle for anything substandard. Like, for example, and this is completely going off course, but my younger brother, he has keratoconus. He has issues with his eyes. And, I would not want the surgeon operating on him to be thinking about getting home as quickly as possible, or, cutting corners to try and finish the day a little bit early. For me, and I say this is the same thing with my technicians, but it comes from the top, really. As long as you have that drive to want to produce the best possible outcomes for your patients, put the money aside, forget the money.
Yeah.
I'm just talking about the love of your patients. As a doctor, you got, as other, and hopefully other doctors are also into this, but as a doctor, you got into this industry to better people's lives, okay? And I feel that a lot of doctors nowadays are trying to better their own lives off the back of making money from patients. And I'm not calling people out on it. I'm just saying that that's what I'm seeing more and more of in this industry. If you're going to do something, do it with your heart, do it, wholeheartedly, give your all, go home knowing that you've done the best possible thing that you can for your patients. And that's what I try and do on a day-to-day basis, and that's what my practice completely stems around: being ethical, setting out the same ethos for my technicians to work from. They know if we have to be there till 8 o'clock at night, we'll be there. I mean, I think you called me once, and I was still at the clinic at 8 o'clock. And I said, "Look,
Yeah.
Melvin, I can't take this call now, and I'm still in the middle of what we need to do." So yeah, for me, I will only go home when the procedure is satisfactory to my liking. And having sincere technicians that are willing to go that extra mile with you is rare. You have to trust the team that's going to be working on your head. Yeah.
Excellent point.
I thought I'd just go through another patient again who we did a slightly more aggressive, quote unquote, aggressive hairline for.
He's another dark-haired guy, right? Looks like
he's brown hair, but he still had fine hair to work with. So it's not coarse brown hair. This is fine brown hair to work with, okay? But he wanted to go with this line that was slightly lower here. And I said to him, no, I'm not going to do that, right? So again, even though we'd had a preoperative consultation, even though we'd already pre-agreed a hairline, which was this one here, this dark one that I'd originally marked off, he was like, actually, Doc, if we can we go a little bit lower? So I said to him, look, if we have the grafts to be able to do so, absolutely, I'll be more than happy to go a little bit lower. But at best case scenario, I can scatter singles between this block line and this dotted line here, okay? Which in essence is what we pretty much did. So in terms of post-operatively, I mean, this is 12 days post-op. You can see most of the scabs are now off the head. And you can see when you go that low and you're sitting pretty close to what we call the frontalis muscle here, the angles of the hair have to change a little bit. You can't have them forward facing. If they kiss this part of the muscle, and it's almost like a cheat code, to be fair. If you put your hairs kind of facing off at a right angle or going slightly in a reverse direction right at the very front, and this is just some education for other surgeons wanting to create natural outcomes, then it creates naturalness. If you look at any hairline close enough, you'll see that the hairs, especially someone who's got a very aggressive natural hairline, you will see that their hairs aren't forward facing. They're going off a little bit at a tangent. And then, that kind of, this guy is kind of 10 and a half months post-procedure, and you can kind of see where he is. It's all about creating that sort of naturalness, as it were. And again, this is working with fine brown hair. It looks amazing.
How many grafts did he get?
This again, 2,200 grafts. In my practice, I will very rarely go more than 2,000 to 2,400, maybe pushing 2,500 grafts in a single surgery. Okay, I do all the surgeries in a single day. I don't do any surgery over 2 days. I don't try and extract 3,000, 4,000, 5,000 grafts. I say, look, this is your cutoff, because I personally believe that there's only so much trauma the scalp can take. There's only so much blood that can provide nourishment to the grafts. There's only so much that you can take as a patient. To sit in a chair for 2 days, 12 hours at a time is mind numbing, is draining for patients, is very uncomfortable to be face down, to turn your head a different,
Stop moving.
Stop moving.
It's hard.
And people are fidgety. We use traditional, FUE has not really changed a lot. Okay, let's be honest. There's maybe newer devices, there's quote unquote newer techniques, which people have tried to put the name to. but it hasn't really changed. If you get the basics fundamentally correct, good extraction, good handling of grafts, good angles with your incisions, and finally implanting your grafts with some level of care, then you will get a good outcome. And we use a combination of things. It depends how many of the grafts are implanted by me. So if I'm implanting, let's say I'm doing the first couple of 100 grafts, hairline in particular, I like to make sure that I get the singles in, because singles are important. But I think one of the things that we haven't touched on yet, Melvin, and I do want to raise this finally as a last point, is post-operative complications. And although nowadays people don't really want to talk about it, and I see surgeons shying away from talking about it, and I don't know
Yeah.
why, because I think doctors need to be educating other doctors on how to manage these complications. Okay, and unless we talk about it openly and frankly, without any judgment on the other doctors, people are not going to talk about it. And things happen, things go wrong. And in my situation, I had a patient who came in to have a hair transplant surgery and should have got what I would have perceived to be an absolutely amazing outcome. So, I mean, look, for example, this is dense packing, relatively high dense packing with sort of 2,300 or so grafts. He had naturally black hair. The blue dye, this is blue dye, by the way. So this is Mefar blue. Again, you can see the tissue looks nice and healthy. There's still a little bit of remnants to the bleeding, as it were. A bit swollen, did bleed a lot on the day of the procedure. But he then, as he was getting out of the taxi, he rubbed the top of his head along the liner of the taxi. And this is both this is both a risk of infection. You can cause trauma to the scalp at this point because everything is still very, very numb. The anesthetic.
This was right when he left your clinic.
Within 45 minutes, I got a phone call to say, "Hey, Manny, I banged my head on the top of a." He couldn't tell me whether he'd banged it or whether he'd rubbed it. Either way, it didn't really make a difference.
Yeah.
And I was like, "Look, we're gonna have to just see how this one plays out, mate.